and I'm a certified nurse midwife by trade. But I'm also blessed to be the co-founder, CEO, and medical director of a healthcare center out of Cleveland, Ohio called Village of Healing and the Village of Healing Center. I get to share that responsibility with my co-founder, friend, and sister that is in the room, Tanisha Gaines, as well. In 2019, we established our organization after essentially being tokens for white institutions, sitting in rooms talking about infant and maternal mortality. There was a lot of conversation, a lot of meetings about the meetings, but there was really no action steps to truly step in and save Black women and Black babies. We noticed that Black organizations were coming before these committees with solutions that were working. One in particular in Cleveland, Ohio was 44128 zip code, went from having the worst infant mortality rate in 365 days to 0 deaths. By just simply being grassroots on the grounds, having conversations with the residents who told them, do not come in here and tell me my baby is getting ready to die. I want to have a conversation with my neighbor. I want to have a conversation with other individuals. And then if you want to work it into that conversation on how I can do better, I'll do that. Tanisha and I sat in that meeting and was like, all right, let's pack up our stuff. We good to go. Let's implement this everywhere. And we were told we needed 5 to 7 more years worth of data before they would implement it throughout the city. So myself being of reproductive age, Tanisha had just recently had a baby and said she was waking up every single night to make sure her baby was breathing. My friends were also making decisions to not have children because they knew their lives were at risk and their babies' lives were at risk. I didn't have 5 to 7 more years to give for them to decide that this was a solution. At that same time, the study had come out to say Cleveland, Ohio was the worst place to live if you were a Black woman, just simply validating our already experiences in healthcare with 3 of the largest hospital systems in this country, one of them being world-renowned, where kings and queens fly into for service. However, the people around the corner are dying at horrendous rates, and they look like me. And so we came in second to last in healthcare outcomes as Black women in this country, in Cleveland, Ohio. And so also we were seeing studies that were saying if your provider looks like you, your disparities decrease, your outcomes are better, your satisfaction is better, you agree to care and more intensive care when your provider looks like you. So we were constantly being told to chase the data. That's exactly what we did. And we started a healthcare center that is focused on Black providers taking care of Black patients. Right now we do obstetrics and gynecology. We added mental health in July, and we are now expanding to add family nurse practitioner, pediatrics, and more mental health. And so that center opened up in February of 22. Yeah, thank you. It's all a blur now. In February of 2022, and we have continued to show that we are the answer, we are the solution, and while everyone else continues to meet and discuss, we're gonna do the work of saving our families and our communities.